Do tooth shades actually matter? Here's the formula to choose the right tooth shade for your implants. Getting it right will ensure that your teeth will look completely natural. At 21D, we have helped thousands of patients to refine this formula, and I myself went through this process a while ago. So let's have a look. I think I got a A1 or B1 ordered, which is a lighter shade.
The lightest shade is B1. Most people go for A1. Some people go for A2. It's all based on your skin complexion. So everybody kind of just looks at it and thinks, oh, I should choose that colour. And you look at it on a monitor, and of course monitors look different as well. So you really need to hold it up. When you go for your FCA, your free assessment, they'll hold it up next to you, and you can just do it compared to your skin. That's the most important thing.
Yeah.
Not what I've got, not what Dan's got or Gordon's got, because it'll look different on the computer. Hold it up to your skin, and they'll help you. They're so helpful. And when you're in the clinic, they'll maybe even take a picture for you so you can see what it looks like next to your skin. But that's the best thing. And there's only 3 shades, and there's not a lot of difference, if I'm honest, is there, Dan?
No, there's not. They're holding them next to each other. I couldn't tell you which one.
No, I reckon if you switch them around on a table, I'd probably get them wrong.
Label it. Couldn't do it.
It's like magnolia or pale magnolia or really pale magnolia.
Yeah. Are we confident to say that majority of people pick A1?
Yes.
Yeah.
Yes.
What was your kind of thought process, when you chosen your shade?
There was a bigger card when I did mine, because I'm 2 years this month.
Yeah.
And it was a lot bigger card. And to be honest with you, I was in a little bit of a daze anyway, because I was at an assessment that I never imagined I'd be able to go to or get through or any of that. So I was a little bit dazed. And they did the same thing as I just said. They held it up. We could look and see what it looked like. They had a mirror. The nurse took a picture for me. And it just seemed the right shade for my skin. And yeah, you're the people that know you know that you've probably got bad teeth, poor teeth you're not happy with. So they're going to notice, aren't they?
Yeah.
You can't go, no, these old things have happened for ages. You can't. They're going to notice.
Yeah.
So go with the one that you like, not the one that you're worried about people noticing.
It's something I noticed on FCAs when people come in and I go, hi, I'm Dan. I had this done in June, and they all go, what? they're 21D. I go, yeah, because you can't tell. Like you said, unless it's your partner, close family, people you work with, no one's going to go, you've had your teeth done.
No, someone said to me, oh, you've got lovely teeth. Thanks very much. That's all you need to, it's not a biggie. It's not, this is life-changing enough. You don't need to overthink it.
Yeah. This is how I've chosen my shade. I said, Vijay, which shade should I have? And Vijay said, A1. Okay, thank you.
Which one looks most like George Clooney?
That was my process. It was decided in 3 seconds.
I think probably it's one that most. Some people go for brighter. If you're really pale skinned, then brighter doesn't look as bright. If you're darker skinned, then it looks brighter. So just get them to help you. They'll help you.
So before treatment, how much time did you spend worrying about what shade to choose?
Oh, I didn't.
And looking back now, how important is the shade compared to everything else you gained from?
Oh God,
treatment?
It isn't. It really isn't. Everybody gets so tangled up in it and so paranoid about it because they're like, it's a lot of money, and I've got to be absolutely certain. And what if I hate it? There is such a small difference that this isn't going to be something that you're going to be agonising over, honestly. And if you just... There was somebody on the group the other day that just took a picture of themselves really close up. You are only going to see your teeth because that's what your eyes are going to, because that's all you can think about when you've had this done. But to everybody else, if you just post a picture of that, they'll just go, oh, you look pretty. It isn't the biggest thing that everybody thinks about. And it certainly wasn't the biggest. To be honest, I didn't really give that as much thought as I probably should have done. I just thought, I just want rid of these teeth.
I was the same, honestly. I think I let Paula pick, because they went, I think Arson said, which one do you want? And I was like, and then Paula went, maybe one looks good. Go with that.
What do we know? It's not like we go teeth shopping all the time. No. It's not like we're going to go, oh yeah, I've got experience in this. No, you just...
experience.
You just have to be advised and accept the fact that people are going to help you.
Yeah, it's about choosing the right shade for the individual person.
Yeah.
That's all
Yeah,
it is.
absolutely.
Yeah.
I think it goes through so many different people and so many different processes that if anyone at any point went, that might not work, everyone will look at it and go, yeah, that doesn't work, and you'd be told. So
Yes.
whatever shade you pick, even if you worry about it later on, someone in the process, VJ himself, will turn around and go, that doesn't fit them, contact them.
You're not in a situation here where you've got like bored salespeople that just can't be asked. They want to help you at every step of this, don't they? You get so much support and help right the way through. So if you're worrying about something, let them help you. They'll advise you. You won't be left floundering.
Absolutely. Don't worry about that. The next question is from Sunny. Will the raw carrot in homemade coleslaw stain my prosthetics?
Has raw carrot stained your prosthetics?
No, not that I'm aware
Has
of.
cooked carrot stained your prosthetics?
No.
Has
So
anything?
No carrot.
No, I
get
think
anything?
there was a time, wasn't there? A lot of people were saying about turmeric and things like curry. I've had quite a few now, honestly. 'Cause I think I asked at one point, if you could go back far enough, I've asked the question. And everyone's like, oh yeah, mine's, I was worried about staining, drink loads of water. So just drink.
Yeah,
As long as you're
I
drinking with
don't.
it.
I don't think about it. I've not had it as a problem, and I have a curry once a week, and I have one that's quite red in colour. So I've not.
Yeah.
I think the problem is because it seems such a massive decision. The only way you can focus on not having the surgery is to worry about all the other things, because then your brain is busy doing something. So you're thinking about all of this because you want to make sure that you're absolutely sure about everything. But honestly, they know and they help you and they guide you, and they would never do anything that's going to make you feel self-conscious. The opposite, apart from making you do it live, of course. So they'll help you.
I think the worry isn't it like the same? You spent a lot of money. It's a big decision. It's something that you're so self-conscious of, and we're all the same. We all know self-consciously that everyone's looking at your teeth, but they're not.
They're
and
really
you spend
not.
so long living like that everyone worries that my teeth are going to go orange. I'm going to glow in the dark.
I've not had any staining of anything.
I drink about 8 coffees a day as well.
Yeah. In terms of food, I eat curries. I love beetroot.
Me too.
Which is so kind of
Pink.
and red and whatever. All these things, coffee, tea, red wine. I never had any problems. If I have beetroot or curry after, I go and I brush my teeth.
Yeah.
And I look after.
But to be honest, I think we all do that anyway, don't we? When we've eaten something, you just feel like you want to freshen your mouth up.
Yeah, and you just want to look after teeth. But I never had. I had my yearly maintenance this week on Monday, and clinician said everything is perfect.
What do they do at your annual maintenance?
You go in the room first for a scan.
Yeah.
So that's about 5 minutes done. You go in the room, they do intraoral scan, and they just basically check everything around. I think clinician went and he saw the scans and everything, and he said everything's perfect. They clean a little bit around with something.
It's an airbrush, isn't it?
Something like that. And I think it was about 15 minutes I was done.
Because I know everybody's always worried about that. Are they going to take my teeth out feeling, aren't they?
Yeah.
And they don't do that anymore.
No.
When I had mine done, my data capture, it was very weird, and they did it then, but they don't do that. They don't need to do that anymore.
Unless there is a reason, so they have to. But
Yeah.
normally they don't.
Staining's fine. Just
in terms of food.
sips, water sips.
yeah.
It's no big deal. I mean, if you sat there with beetroot juice in your mouth for an hour, then maybe. I can't guarantee that won't happen. But just in normal life, you can eat things and just have a sip of water if you're worried. You don't need to worry. It's fine.
If you enjoyed this video, be sure to watch the next one on screen so you know what to expect in your dental implant journey. And if you would like a free assessment to see if you qualify for full mouth dental implants, just click the link in the description below.